G'day and welcome back to the channel. So in today's video, I want to show you how to take away knee pain when sitting cross-legged. Now, sitting cross-legged is an important skill for anyone to have in their repertoire because it gives us an alternative to just sitting on a chair. And if you've been a fan of the channel for a while, you'll know that we promote sitting as basically one of the least beneficial things to do as a human being. It stiffens up our hips, it stiffens up our lower backs, it takes away our core strength, basically as we sit in this passive, horrible, hinged, static shape for a long period of time. So sitting cross-legged is a really helpful alternative to that because it really helps keep your hips nice and loose. It allows you to create a platform through your hips, a stable platform through your hips from which to keep a more stable, upright lower back with a well-braced spine. But it can be a problem for a lot of people because a lot of people's knees hurt when they try and get into this position or they're in this position for any length of time. So what I want to go through in this video is I want to talk about why your knee pain isn't probably or most likely a knee issue, and then give you 3 really helpful exercises to make it a lot easier really quickly. But before we get to that, obviously, please let me know down in the comments what it is that you're hoping to gain from this video. Obviously, taking away knee pain is important, but are you someone who has heard that sitting cross-legged is really important, or it's a skill that you used to have that you want to reclaim? Let me know what it is that you're trying to get out of this video, just so that I can make future videos more specific and more helpful for you guys. And then once you've watched the video, please consider leaving a like rating underneath and then consider subscribing to the channel if you do find this content useful. Obviously, a video like this sort of speaks to the type of content that we're trying to promote. The more people I can have subscribed to the channel, the more people will eventually see these videos, which is the ultimate goal. So please consider doing that once you've watched the video if you find it useful. Now, what I want to talk about first basically is that if you are getting knee pain when you're trying to sit cross-legged, it's really important to understand that it's not your knee that's the problem. Yes, it's the part of the system that's struggling and not enjoying that, but essentially what your knee is doing is it's telling you that it's not enjoying a lack of rotation at your hips. So in order to get into this externally rotated hip position, you obviously need a lot of external rotation at your hip. And when we're trying to rotate, or even if you're trying to take it a little bit more extreme and throw one leg up on top or then wrap the other one on top as well, you'll notice that you'll feel a lot of pressure going through that knee. But all that's happening here is we're leveraging the shin bone and we're leveraging the upper thigh or the thigh area based on how mobile, how much range of motion you have at the hip. So if you're lacking some hip external rotation, then something has to make up that difference if you're trying to get into the end position. And the knee is the next most mobile joint in that chain or in that system. And the important thing to understand here is the knee is more designed to hinge backwards and forwards, to flex and extend. If you tend to add a lot of that sort of excess movement through the knee, that lateral movement through the knee, if you don't have that range of motion at your hip, over time your knee can scream at you and tell you that it's not appreciating that. So the secret to improving how your knee feels when sitting cross-legged is actually improving the range of motion at your hip. Now obviously there are some things that you can do to try and help settle any sort of local stuff if you've got some tightness or some pain at the knee, particularly if it's some additional knee stuff that you've already been dealing with. But that knee is getting exposed specifically because that range of motion at the hip isn't where it could be. And again, if you've been following this channel for a long time, you'll know that sitting in a chair and spending a lot of time sitting in a chair or at a desk or in a car is one of the most common reasons, or the most likely reasons why you're missing that hip external rotation. Because we don't use that hip external rotation when sitting, we're just stuck at a sort of a 90-degree hip angle. We never really get into that position. So if you're someone who's trying to reclaim that hip mobility, we're going to have a conversation at the end about how to potentially incorporate this into your day-to-day life to maintain this hip rotation that we're going to work so hard to get. So in terms of that concept, it's really important to understand that your knee discomfort is most likely a consequence of some decreased hip mobility, particularly in that external rotated position. So what we're going to do with these 3 exercises is we're going to address that hip external rotation in 3 different ways, or at 3 different levels. The first level is we're going to go really, really deep. We're going to target the hip joint capsule. And now for anyone who doesn't know, the hip joint capsule is the deepest layer of soft tissue essentially in the hip joint. If you've got your hip joint, which is a ball and socket joint, and you immediately wrap that up in like a plastic wrap, like we do with food, that's essentially the hip capsule. It encapsulates the joint, has a very specific set of functions. But when we're stuck in that 90-degree sitting position a lot during the day, the hip joint capsule or aspects of that joint capsule can become stiff. So we want to do an exercise to reduce that. I've done it before on the channel, you know what it is potentially, but we'll go through it anyway. The second one is we're going to go through a muscular stretch or a muscular specific stretch. We'll do the pigeon stretch, or potentially a version of that, depending on how flexible you feel comfortable being. And the third one is we're going to take a ball and we're going to try and free up some of the soft tissue restrictions or adhesions with an external rotation bias. So that, with that being said, we want to jump into this hip capsule stretch. So again, if you've been following the channel for a while now, you know exactly what we're going to do here. We're going to target this left-hand side. So this is legitimately the best hip stretch you've ever seen. So we're going to start with this because we want to get the biggest bang for our buck in the shortest amount of time. You don't need any equipment. You can use a band here to make this more powerful, but you can do this just on the floor if you can get down there. Now again, if your knee is uncomfortable, you can have a pillow underneath here. I've got a yoga mat, obviously. You can do it outside. Whatever you need to do to support that knee to make this comfortable. But what we're basically going to do here is we're going to take your opposite leg. We're going to take that out the way. Now what the concept that I want to promote here is that we're going to put you into an externally rotated position, then bias this left-hand side to have your thigh bone gently pressing out the back of your hip. What we're looking for here is a gentle pressure. We're going to get some muscular tightness involved here, but we want a deep pressure to make sure that we're doing the right thing. So what I want you to do here is with the side that you're trying to stretch, I want you to rotate your foot underneath. So we're externally rotating that hip. Rotating your foot inwards does that in this position. It can sound a little confusing, but we're externally rotating the hip joint. What I want to get you to do is then drop your back leg down to block that foot. You can pull it up as far as you feel comfortable, but just find a position that feels very safe and comfortable for you. Now what we want to do here is we're going to shift your hips and shoulders back towards the camera. So we're going to shift towards the side that you're trying to stretch. The mistake that a lot of people make with this, and the reason why they can't find a proper stretch here, is a lot of people leave their shoulders behind and just dump their hips off to the side. Now you might still get a decent stretch from doing this, but it won't be as effective and beneficial doing it that way. You want to make sure that your shoulders and hips stay connected. We want to shift them across together until you feel like you're getting a little bit of pressure at the, not the side of the hip, but the back side of the hip, potentially where the back pocket would be. Now we're not trying to tilt over, we're trying to stay sort of level with the ground the whole way across. And you shouldn't feel like you have to go really far to find it. You should be able to find some gentle pressure and some gentle tightness pretty much straight away when you shift to that side. Now, what I want you to think about when you're doing this exercise is we want to imagine that your thigh bone is pressing out the back of that butt cheek. So you're not actively holding this position, you're almost trying to let your hip muscles relax and sink into that thigh so that your thigh can push out that side. We want to stay here for 30 seconds, stay here for a minute, stay here for 2 minutes, whatever you feel comfortable doing. But then also, as I said, to make this more beneficial and to get more out of this, if you have a power band, which I'll leave a link to in the description, you can wrap that around the hip and have that distracting it out this way. So you have it tied to a post or a bed head, for example, laterally, and you're shifting towards that band to open up that hip and distract that hip to improve the range of motion from this exercise. We're going to spend a few minutes, a few seconds, depending on what you feel comfortable doing, in this position, allowing this to free up. Make sure your knee's well supported so it doesn't hurt. And then once you've done that, I want you to reassess immediately how it feels to sit cross-legged. And for me, doing this side, it automatically feels like I have a lot more range of motion, a lot more room to move in this position that I didn't have before. I feel less tension, less pressure on my knee, and I want you to feel the same thing. So if we can get you there, sit cross-legged before the exercise, do the exercise, then sit cross-legged again after the exercise. We need you to see what the exercises do so that you know specifically what works best for you. The second one is sort of a modified pigeon stretch or a version of a pigeon stretch. Now I'll do this on the mat obviously, but please feel free to do this up on a chair or on a bed or on a bench. It's really important that you can find a position that you can get into really comfortably that doesn't stir up your knee, you can control really well. So what I want to get you to do here is we want to get you to start with your foot up in this position, and we're essentially going to get you to rotate down into this shape. So obviously if you're standing up, we'll get you to start with your foot up on something and then rotate that down as far as you feel comfortable. Now, if you feel like your knee begins to feel a little bit uncomfortable, you can support it a little bit. So you can hold that knee a little bit and still find some leverage to free up some of that tightness at the hip. But for me, because I'm relatively flexible in this position, I can drop that knee down a little bit. We'll maintain a straight back. We don't want you to go as far forward as you feel comfortable, because obviously I can get to this point and I can lower down further, but most of that hinge is coming from my back. It's not coming from my hips. And what I'll get you to do here is when you're in this position, to find the best position for you, is I want you to imagine that you're pulling your hip back a little bit, so pull it sort of backwards a little bit as you drop down. And we're looking to find some tightness in that sort of back pocket area where your piriformis, where your glutes might be. And what I want to get you to do with this is, holding this position on its own can be a really powerful stretch for a lot of people. But I want to get you to rotate from one side to the other to find where your best version of the stretch might be. So for me, if I'm going straight, I feel a little bit of a stretch. But if I improve that rotation further, I feel a fantastic stretch in this particular area through here. Now, again, what we've talked about a lot on the channel is that it's not good enough anymore to just hang out here for 30 seconds and hope that the muscle gives. We need to get the muscle active, we need to get your brain and nervous system active to get the best and fastest results. It's that PNF stretching or that contract relax stretching. So what I want to get you to do here is, once you've found a good position, is wherever you find that tightness is, I want to get you to give it a gentle squeeze. So try and tense up that tight spot. If it means pushing your shin and your knee into the ground to flare that muscle up, that's completely fine. Again, make sure your knee feels comfortable here. But then we want to tense that muscle up. We want to squeeze it for 5 to 10 seconds. Then I want to get you to relax. And as you relax, what you should find is, you can now drop deeper into this position than you could before. And the reason for that is that your brain and nervous system, when it's contracted to a certain degree, it then reflexively relaxes to that same degree once you let go. And if you've got a muscle that's holding on, if your brain and nervous system is asking that muscle to remain tight, then it relaxes and allows that tissue to give relatively quickly. So again, we can repeat that cycle for 30 seconds, a minute, for as much or as little as you feel comfortable doing. But then again, once you've done that, we want to immediately retest your sitting cross-legged. So for me, I'm very fortunate that I can sit in this position comfortably, so I can take it to the next step and wind that up a little bit further. And straight away, again, it feels like there's less restriction in that hip. Again, I feel virtually nothing in my knee. I actually feel a little bit lopsided, so I'll need to do the right side sort of off camera to sort of even this up a little bit. But again, that's addressing some of the tightened musculature that restricts that external rotation that again affects the knee. So, excuse me. So again, that's the second of 3 exercises. The third one basically just involves taking a tennis ball or a lacrosse ball and jamming it into areas that feel tight for you. So I'll do this right side just to balance things up a little bit. But again, we want to bias that external rotation. So we're going to get you to take the ball, let it press into that hip a little bit, and we're going to get you to relax onto the ball. Now, you might find that you'll have to roll over to your side a little bit just to make sure that you can really target the spots that you need to. But in the spirit of externally rotating the hip, I'll get you just to gently lift that hip up and rotate it as far as you feel comfortable. So you can be down here if it's easier, you can be up here if you want to add a little bit more hip flexion into it. Obviously, the further up you go, the better it will feel, the better it will be for your knee long term. Excuse me. And all I want to get you to do here is I want to get you to move around until you find a spot that feels tight, stiff, or tender. Now, the same concept as what we just did with the muscular stretch before. Staying here and not doing anything isn't as effective as making your brain and nervous system function at the same time. So what I want to get you to do is, once you've found a spot that feels particularly tender, so for me there's a juicy spot just here, I want to get you to tense up that muscle that's in between sort of your hip and the ball basically. So get that muscle to work, you'll push the ball away a little bit, hold that for about 5 to 10 seconds, contract that muscle, get your brain involved, so that when you relax, you should feel like the muscle gives a little bit and the ball sort of sinks in a little bit further than it did before. So all I need you to do for this is just to hunt around for those areas, give it a squeeze for 10 seconds, maintain that, then relax. Do it again if you feel like it still has a little bit more room to give, and see how that feels. Excuse me. And then the other way that you can do this as well is, obviously you can roll around a little bit. It's not as effective as the previous technique. But the other thing I'll get you to do is we can then get you to rotate and adduct your leg at the same time. So we're putting some pressure through the muscle, and then we're basically trying to bend that knee, bend the hip and twist that hip to sort of shear free some of that muscular tightness. It's another effective way to basically find any of those restricted tissues and sort of shear them free to make them a little bit looser. So again, with our test and retest, I'm glad I did that, because now that right hip feels a little bit looser than it did before, and again, there's less pressure on the knees. So just to wrap it up, basically, those 3 exercises are fantastic exercises to improve the external rotation of your hip, which in turn takes the pressure off your knee to make sitting cross-legged a bit easier. So again, let me know in the comments how you went. If you have any specific requests in terms of that knee pain, let me know in the comments. Leave a like if you found it useful. And then please make sure that you subscribe to the channel if you enjoy this content. But with that being said, thank you, and we'll see you in the next one. Bye.